Hello, I'm Dr. Niskoda. Welcome back to AZH Center in Milwaukee for another edition of the Wound Care Window. Wanted to share with you some interesting findings related to a therapy that we've introduced you to in the past, dermaPACE. I'd like to share with you a patient. Here is a photo from about 2 months ago. You can see she presented with a very painful right lower extremity venous ulceration. We spent some time convincing her that she needed venous ablation for her severe venous insufficiency, and she underwent all those procedures. And then we convinced her that continued aggressive compression therapy would get her healed. And she has done very, very well in a very short period of time. So today she comes into clinic. We've taken off her compression wrap, and here is her ulceration. You can see that there is a significant decrease in the inflammatory change in the peri-wound. The ulcer itself looks much more viable, a little bit of fibrin and slough over it, but significantly less drainage per her report, as well as evidenced by the appearance of the dressing. Much more granulation tissue. You can already see some neoepithelium heal across this. What I wanted to share with you today is that you are well aware as wound care experts that these venous ulcers can be incredibly painful. And this patient did have significant pain associated with her ulcer. I have been using dermaPACE in somewhat of an off-label indication for a variety of wounds, and we've got some very interesting observations that I'd like to share with you today. One of the things that we've realized is that there is a marked decrease in the pain that patients have following the dermaPACE treatment. I have especially seen that in patients with venous ulcers, and this patient is a good example of that pain response. And I'm just going to interview her here and let you see for yourself, hear from her own words as to how this has improved her pain. So when you walked in today, you were describing to me that we did dermaPACE on you last week, the first time, just
Right.
We've only treated you once, and you had some observations following that procedure.
Well, the week before I came in, I think I had a day where I took 13 Excedrin
Wow.
because the pain was so bad. Then when I came back for the re-wrap, you did that
dermaPACE?
dermaPACE. And this week I had very little pain. I had some, but not like it was last week.
And the only thing that we changed was that single treatment with dermaPACE.
Right.
On a scale of 1 to 10, again, before the dermaPACE was accomplished,
Between 5 and 8.
5 and 8.
Yeah.
How about this last week since the dermaPACE? What would you rate your pain as?
A couple of days I had maybe a 3. Yeah, it really changed.
So significant decrease
Yeah.
in pain.
Mm-hmm.
Okay, very good. Well, thank you so much for sharing your story
Sure.
with us. So in today's world, the opioid crisis and the challenges that we face as wound care practitioners in the management of our patients with pain, I think that this therapy might provide some very interesting outcomes. And certainly a few treatments with dermaPACE, decreasing the amount of pain medications a patient is taking. In our experience here at AZH, we've had patients completely come off their opioids. I think this is an interesting finding, which certainly requires much more study and research and evaluation, but interesting food for thought. So thanks again for joining us on this edition of the Wound Care Window.